Thank you, Matt. It is Wednesday, which means it is time to highlight the top headlines of the week in the health world. We are joined by our buddy, Dr. Syed Hussain of Trinity Health of New England. Welcome back.
Thank you.
Now, we have a couple of topics to get to this morning. First up, there is a new genetic test that could detect the risk of obesity. So tell us how that works.
Yeah, I'm excited about this, Symphony, because this is a step in the right direction. We know how big of a problem obesity is. So for viewers, this is a research study that just got published in a journal. And researchers looked at data, genetic data, for 5 million people, predominantly in Europe, and tied that to obesity, looking at the BMI. So what this means is, what they were able to find is there's some correlation between this testing tool, this risk scoring tool, and the predictive capabilities of this tool to say, okay, Syed Hussain now as a 10-year-old is 10 times more likely to develop obesity as an adult. What it doesn't do is predict, okay, Syed Hussain, when he grows up, when he's 40 years old, he's gonna have a BMI of 38. Because remember, genetics is only one component that determines whether a patient is at risk for obesity. It's the environment they live in, healthy habits or not. All those factors go into this. But it's a step in the right direction because it may help us to at least identify at a really young age, childhood, who is at more risk. So what interventions can we put in place to prevent weight-based health changes that will occur? Heart disease, diabetes, folks are well aware of some of the risks related to obesity. So more research is needed, but it is interesting indeed.
Wow, that is pretty interesting.
Yeah.
Like you said, it will help families kind of navigate what they can do in the meantime,
For sure.
right?
Yes.
Okay, now our next topic, we were talking about prebiotic sodas. There was a lot of them on the market. I do enjoy a particular brand. I won't say which one. But when you look at them, it gives you the impression that they're healthier than maybe a regular cola because they have stuff that's supposed to be good for your gut.
Right.
Do they really work?
Yeah, so let's talk a little bit more about this. It's very timely because we've seen a whole host of beverages on the market in recent years, whether it's vitamin-infused water, it's flavored seltzer. Now Pepsi's coming out with a new product early next year related to prebiotic sodas. So prebiotics are basically fiber. This is fiber that is generally found in fruits, vegetables, grains in a healthy diet. And it is necessary for the gut microbiome. What's that? That's the good bacteria in your gut. We need that good bacteria for optimal immune health and overall body function. It is really, really important. So that fiber is important and can be found in these drinks. Now, there's also some cons here that we need to talk about, including, if you have inflammatory bowel disease or if you have a very sensitive gut, it may exacerbate symptoms, especially if you don't take a lot of fiber. So pros and cons related to this. Long story short for viewers is it's a healthy treat once in a while, or if you're traveling, you don't have access to healthy food rich in fiber, then it's probably a good supplement. But to take it every single day in place of a healthy diet would probably not be preferable.
Okay, so don't count on those little sodas to help you meet your fiber goal.
That's right.
It's best to get it through foods, right?
Absolutely.
Okay.